Well, it is true that we come from a country where we seem to, this idea of helping people seems to be inculcated into us. And I'm proud of that fact. It excites me that our country donates more and is willing to donate more and help more. The challenge is to try to figure out how to help people and help people appropriately. There's such a thing as the ugly American approach too. I've seen this, people who are good-hearted, trying to do their best, and yet what they're leaving behind and what they're creating for the short period of time they may be in a country, it's maybe 180 degrees out of sync what it should be. Particularly today, when there are skilled physicians, surgeons, almost all over the world. There's people with the talent and the training. It wasn't the case 50 years ago or 60 or 70 when Albert Schweitzer was doing his thing in Africa. He was it. But today, there's not a country you go into that you can't find people who have some talent and some ability that can be built on, perhaps. And as we've mentioned before, these people know their country and their needs and what they have and what's accepted in their country better than an outsider does. When we first got started with our program in the Philippines, it was because certain doctors there who had a good heart, wanted to help their people, came to me and said, anything you send us, you're a colleague, you're visiting in our country, you're living in our country, you're going to be here for a number of years. If there's a patient that you see that you'd like to have us take care of, a problem, we'll do it for free. They did this because I'd already sent several patients to them that I had seen, children that had needs, and that were easily cared for and taken care of and weren't being cared for. And they'd taken care of these kids for me, and I'd offered to pay and had paid in a couple of cases, and now they came to me and said, hey, you don't need to pay us anymore, we'll do them for free. One of the hospitals said, hey, why don't we give you 6 free operations a month? It was a kind and generous gift to me to pass on to the people that I saw. And so we decided, well, if we're going to do this, and the numbers grew as the time went by, the doctors are willing to do what they do best, and the hospital is willing to do what it does best, and my job is to facilitate it. My job is to make it easy. These doctors don't want to have to go out and find the patient and care for them and worry about post-op treatment. I'll do that. The hospital wants to have them show up at a certain time and be prepared and ready and have certain laboratory work done ahead of time. I'll take care of that so that the patient is ready to go and the hospital does what it does best. We selected at that time certain operations to be done. We said we'll take the child with crossed eyes, with cleft lips, and with club feet. Because these are easy to spot and easy to diagnose, and we know what's going to have to be done for each of these patients. And we can predict it, and one operation will usually cure the problem. And their whole life will be changed. A life-changing procedure. That's how we got started.